So I'm a hematologist or a blood specialist, and we do bone marrow aspiration biopsy, which is a very simple test that's done on a regular basis to recognize or diagnose various types of blood disorders. However, every time I mention bone marrow aspiration biopsy to a patient and explain the procedure, I can see that the patient is getting anxious, they are getting sort of fearful of the procedure just because of the nature of it. So what exactly is this bone marrow aspiration biopsy? If you go to a doctor, they will order blood tests. And how was the blood test done? They put a needle into the vein and they get blood sample and test it. Similar to that, when we need to look at the factory of blood that is called bone marrow, we have to put a needle into that space and get the sample and test for it. Unfortunately, just like for blood tests, you would not know what is your hemoglobin, what is your blood counts, unless you take a sample from the vein. We as hematologists would not know what is the working condition of your bone marrow until we put a needle in there and get the sample. Yes, it is a procedure where we put a small needle into your hip bone. We call it the pelvic bone. So we put a small needle through there and with the help of some local anesthesia get the sample. At the same time, it's not an extremely painful procedure. It can actually be done for anybody as young as 2 months, 3 months, all the way until 94, 95 years of age, as long as we ensure that they are healthy and fit to tolerate it. Now, how important is this bone marrow aspiration biopsy? It's extremely important. So if we are suspecting a blood condition, blood cancer, a type of myeloma, leukemia, then without doing this bone marrow aspiration biopsy, it is almost impossible to complete the diagnosis and evaluation for this condition, and hence to start the appropriate treatment. So if your doctor recommends a bone marrow aspiration biopsy, don't shy away from it. Try to have a thorough discussion with your doctor, get all the details about the procedure, and look forward to how you can diagnose your condition so that it can be treated at the earliest in the appropriate way.